My name is Anna Von Ruden. I am the Chief Program Officer here at FamilyWise. So I have the pleasure of working alongside your fantastic hosts today. So as we wind down to our day, I just wanted to pause and say thank you. Thank you for your time, your energy, your attention today. We appreciate everybody who contributed questions, dialogue, and just overall listen to the content that we had today. We hope it's been engaging. We hope it's been inspiring and ultimately just beneficial to the communities that you take your knowledge and wisdom back to. So we know that Zoom fatigue is certainly a real beast. Hopefully the end of our day is a provocative lineup for you, and we'll close out with a few following resources. I think it's definitely worth the wait. On deck to take us through the home stretch is going to be a resource sharing opportunity, a well-being index report out that Cassandra will offer. We have a policy analyst, Angie Tees, that we're really excited to have. And then finally, a reading. And so Lisa, I'm going to turn it over to you to get us started on the upcoming resources that we have to offer and share today.
All right. So yes, we're winding down the day. So we do have a few things that we like to share. Excuse me, that we'd like to share with you today. Some of our resources that we have that we're going to be sorry, I have to let people in as well. That we're going to be that are gathering today. It's been a long day. So we'll just take a little moment and share some things. If you like to stay connected to FamilyWise services, we encourage you to check out our new web page and stay in the loop about, excuse me, while I'm doing this, can someone watch the
already taking care of it?
Yep.
Okay, thank you, because I'm stopping to admit people. Great, wonderful. So yes, we encourage you to check out our new web page and stay in the loop about our upcoming events that we will be offering by signing up for our new newsletter, Newswise, like FamilyWise, Newswise. We wanted to share some upcoming events and resources. So next Wednesday, June the 22nd, we will be hosting the Cultivating Community Wellbeing webinar. And that's going to be from 12 to 1 p.m. We've included a link to this section in the chat, so we can get that in the chat and we'll provide that for you. Another event that we encourage you to check out is the 14th Annual Community Empowerment. It is through Black Men's Healing Conference, and it's going to be held virtually again this year. Those dates is going to be September the 22nd and September the 23rd. We'll provide that link as well for you. Finally, here are some other resources that we wanted to highlight. Some links to these resources will also be added into the chat. Thank you so much again. So we also want to invite you to share any upcoming events or trainings that you would like to share with other attendees here today. We will compile all of the resources that you share and send them out in the follow-up email. We'll be sending a post email, and so we'll also include some of those resources in our follow-up email with everyone. For now, I will turn it over to my colleague, Cassandra, to share about the FamilyWise Wellbeing Index. Thanks again.
Hello, good afternoon. My name is Cassandra, and I'm the Senior Evaluation Analyst at FamilyWise. I'm going to start sharing my screen. Oops. It actually says that I can't share my screen.
And Barb, could you make
so-
her a co-host?
All right. So you get a preview of the last page. And all right. So good afternoon. My name is Cassandra, as I said. So this year, FamilyWise introduced our inaugural Family Wellbeing Index to bring attention to the health and well-being of Minnesota families. I will put the link in the chat shortly. The report looks at factors that help families thrive, from system level formal supports, which we refer to as concrete supports, to personal relationships or informal supports. We gathered information from a variety of resources, including government, state, and local data, and supplemented by conversations with our staff and program participants. Our report affirms that while Minnesota ranks above the national average in measures of family well-being, including living above poverty, living in affordable housing, and access to healthcare, the data shows significant disparities in Minnesota between white people and Black, Indigenous, and people of color. For instance, a deed analysis showed that Black and Indigenous households had median incomes of less than half that of white households. 43% of all Minnesota renters live in cost-burdened housing, and 58% of Black renters are cost-burdened. We also discovered that while there's ample data available about families' needs and risk factors, there's little data about the strengths that exist within Minnesota families and communities. The Minnesota Student Survey data sheds light on how supported youth feel in their homes and in their communities, but we do not have statewide data on protective factors in Minnesota adults, such as whether they have someone to call on in an emergency or feel supported by those around them. And that brings me to our calls to action at the conclusion of the report, which I've zoomed in on here. So we conclude the report with a series of calls to action that all of these connect to live links. The calls range from advocating for policies that ensure access to concrete supports to families, to collecting data on strength-based indicators, to volunteering your time to organizations supporting families. We hope that this report will serve as a resource to you and inspire action. And with that, I will pass it back. Thank you.
Thank you, Cassandra. So as I mentioned earlier, Angie Tees is going to be speaking. She has an impressive bio, so I'm going to actually read it so I don't screw it up. Angie Tees is the Child Wellbeing Policy Analyst with the Association of Minnesota Counties, AMC for short. In this role, she works closely with public health and human service professionals to elevate policy initiatives that are centered in child and family well-being. Angie has over 25 years of government relations experience, having worked in healthcare policy prior to joining the Minnesota Association of County Social Service Administrators and the Association Minnesota Counties as a Foster American Fellow in 2019. Angie resides in White Bear Lake with her 2 sons, spouse, and animals. In her spare time, she enjoys hiking, nature, politics, and a refreshing summer patio. Thank you for being here, Angie. Go ahead whenever you're ready.
Yep, I'm going to take myself off mute first. And I have a short thank you. Thank you so much for having me. I have a short presentation and I appreciate the invitation to be with you this afternoon. Let's see if I can share my screen. Maybe. I just had it up. You see what I can do here. You would think after a couple of years, right? But everybody says that. Let's see. And if not, I can just, there it is. Okay. So you may be wondering, what exactly does a policy analyst do for the Association of Minnesota Counties, and specifically what does a child wellbeing policy analyst do? I have multiple tabs open. That is probably an indicator of the work. But essentially my job is to work really closely with local government, state government, and even our federal congressional delegation, depending on the subject matter, to really improve systems and look at policy objectives that are in line with supporting child and family well-being. I also work closely with Casey Family Programs, the Sauer Family Foundation, and other nonprofit and philanthropic organizations that have these same core values and look at ways that we can better Minnesota's system. So I was asked just to come in and kind of talk about the 2022 legislative cycle, and then also maybe give you some like tangibles of ways that you can engage or what you might have on your horizon. And so I'll try to do that in a pretty brief and then leave time, for 5 minutes or so if you have questions or want more specific guidance. And so if you're seeing the slideshow, so here's the 2022 legislative landscape. And I'm going to make an assumption that you track this, maybe not as closely as I do, but you probably know that we closed session. This was a non-budget year, but we had a tremendous surplus, and we were all hoping that that surplus would somehow show up to, again, support children and families, support community, and really help Minnesotans in many ways. Unfortunately, the bills that did pass, we saw a couple of bills pass. One was the mental health package, and we also saw a Department of Human Services policy package that had some pretty significant policy tweaks as it relates to the areas of kinship and some definitions around in the child welfare space. You may be wondering, okay, well, why wouldn't they finish this work? It is an election year. And what I would say is that they didn't really finish their work because it wasn't a budget year and it is an election year, and there's redistricting, and over a third of the state legislature is retiring, and everybody is up for re-election. And so we have a Democratic governor, we have a Republican Senate, and we have a slim margin in the House with Democrats. And there is really a hope that redistricting will change hands. And so we may see the House become Republican, we may see the Senate become Republican or stay Republican, and we may see the governor stay as a Democrat. And so largely, I think there's this sense of, well, and conversely, we may see the Senate turn Democrat and the House turn Democrat. And so there was a lot of maneuvering, because if you maintain control of both the House and the Senate, and if the governor is a Democrat, you have a stronger position to really get your policy initiatives forward. And without that majority, there is a lot more, there was a gap in agreement on what they needed to do specifically in health and human services. And a lot of that gap was really between Senator Abler and Senator Upke and Chair Schultz and Chair Liebling. So with that, I think the next slide I have. And so what we know, and I think this is indicative of what you've been talking about today, is that really when you look at child and family well-being, you look at concrete supports. And so this slide in particular and my next slide come from Chapin Hall research that was done over the last, I think, 5 to 7 years by Claire Anderson, and really indicates, so as a Foster America Fellow, I came in really steeped in the world of Family First Prevention Services Act and in looking at prevention-based programming with an eye to reducing the disparities in our child welfare system here in Minnesota. And so we know that some of the best predictors of involvement with child protection or child welfare are all due to economic supports and all due to familial supports. Does a parent or a guardian have someone that they can call if they reach a trouble spot in their life? Are they at risk of having their lights turned off or their heat turned off? Is their housing insecure? And so again, Claire Anderson's research here, she compiled it again over about a 7 to 10 year window. And this is, it's a really handy slide when explaining all of the contributing factors that go into child welfare, or excuse me, the protective factors. And then also, I included this slide here, again, very important. But you'll see income loss, cumulative material hardship, housing hardship, and then the strongest predictors of investigated neglect reports. And so again, this is definitely an area across Minnesota. It's probably no surprise to you. I work across all 87 counties, and again, closely with Public Health, Human Services, and our commissioners. We are a county administered system. And so when I would encourage you to think about government, think about your local government, your city and your counties, and think about your state government as well. Each of those branches can make investments into child and family well-being, and we should be asking them to do so. I also talk fast, so you can put in the chat box if you want me to slow down. So 2023 and beyond, as I mentioned, most of the work really didn't happen in 2022. And what that meant for counties, our priorities were in mental health, in my space, the child well-being space. Mental health wasn't really, children's mental health wasn't funded beyond what was in the mental health package. We did not see investments in childcare. One of our priorities was in around the childcare assistance program basic sliding fee reprioritization. And then we also did not see an investment in the Family First Prevention Services Act. We have some requirements there that are necessary. And frankly, we need an investment in programs and services across Minnesota so that families can access this. So all of that was left on the table. We will be revisiting that again in 2023. So what does this mean for your participation? Probably, again, no surprise, but stakeholders, including the state, counties, providers, tribes, we're all kind of looking at what did pass, what didn't pass, what do we need to get ready for, what do we need to kind of pivot and stopgap, or provide funding in the meantime, and then what do we need to be positioning for 2023? And so that really means beginning to craft our 2023 legislative proposals. So on the radar for counties, as I mentioned before, we know that economic supports and trauma-centered, culturally responsive programming are critical to support Minnesota children and families. I was thrilled to see your earlier slide, and I look forward to digging a little bit deeper into your report. And we know that it's really important to prevent the need for deeper end engagement in the child welfare and child protection system. While we need to go through our annual processes, as I mentioned, that establish our priorities, AMC and MACSA are anticipating to continue elevating the issues of childcare access, increasing access to mental health supports, that is family, children, individuals, kind of running the entire gamut, establishing and building upon community-based support models. Not sure if you're familiar, but we are really interested in a model like the Family Resource Center, which has worked in over 35 states have a Family Resource Center network that's been developed and is really showing promise at preventing child abuse and neglect. And ultimately, really looking at initiatives that are community-based, have prevention at the core, build in community members' lived experience and individuals into decision-making. And we know that that's one of the strongest predictors to make sure that programs are effective and that resources are allocated into the community, again, in a very effective and meaningful way. We're also keenly aware that federal and state funding may be linked to evidence-based practices and that communities and families need access to trauma-informed, culturally responsive programming. And communities and families need to be at the core of that decision-making, like I just mentioned, helping to guide government to more responsive and effective decision-making and resource allocation. So the governor and numerous other individuals included proposals last year, somewhere in the hubs. They had a community hub proposal. There were some specific African-American cultural proposals. Again, childcare is a huge one. They really didn't get the traction that was necessary. And honestly, we also have really high acuity mental health needs that we need to begin to address in the system. And so those, again, will all be on the table for 2023 for the governor and the state to consider. So where do you fit into all of this? You are critically important. I am critically important. All of us really are. And as we consider this session and sessions to come, regardless of the makeup, whether it's Democrat, Republican, or a mix. We're in a purple state now. It's critical that you connect locally with your legislators and with your local elected officials. From the local perspective, I can say it's really important to establish a connection with your city and county government entities, specifically your public health folks and your human services folks, or if you lean more into the public safety or corrections, reach out and get to know your county folks if you don't already. If there are local or regional coalitions, I would highly encourage you to get involved in those as well. As a county administered system, as I said, our corrections, human services, and public health services are delivered at a local level, with each county best positioned to inform and impact their local work. And so they are making local decisions and have access to local dollars. And from my perspective, the most important thing any of us can do is stay connected with your elected officials. And so if that means that you are opening a new center or getting a new program up and off the ground, or have an existing one that has a really strong track record, take the time to invite your legislator, take the time to invite your commissioner. Let them know that you are a local resource and help showcase that work. That is very important and meaningful work, and legislators really crave it. They are looking for things that are new, that don't rely on government, and don't kind of rely on, you know, the funding stream coming from the state and locals, et cetera. So we're looking for new and innovative things, is what especially the Senate has shared. And so take the time, build the relationship, make sure that they know you're there to consult with. And I think with that, if I talked fast enough, that gave us 5 minutes. And I hope that's what you were looking for. And if it's not, I can do my best to address anything that's missing.
Thank you so much, Angie. I'll peek and see. I didn't notice any questions in the chat for you. Wait a moment. Thank you. And then just selfishly, I will say I appreciate your ability to maybe use language that I was able to absorb and understand as somebody who is not so saturated into your world and your space. So I very much appreciate that I, could interpret the language and feel much more well-informed. That was interesting. Thank you.
I'll say I spend a lot of time at the Capitol. I am registered as a lobbyist. I'm a social worker by training. Really appreciate this space and try to make myself available and accessible. So as you or Ann or others, have questions or are looking at priorities, et cetera, I really prioritize working in collaboration and coalition. And so I would encourage you to reach out to the counties. We are a tremendous resource.
Thank you. Thank you so much. Okay, at this time, I'm going to turn it over to Barb. As I mentioned, Barb has a reading for us. So whenever you're ready, Barb.
All right. All right, thank you. The hoarseness is catchy. How that happens virtually, I'm not sure, but we had some issues in the last session too. So thank you, Anna and Angie. That's a lot of good information. Happy to get that. I am happy to share a reading. It's an abridged excerpt of a love letter for the solstice and the new year by Kiara Aku. Sorry for my throat. It's easy to doubt our connections, our friendships, our purpose, our humanity, and the goodness of people. As we collectively bear witness and experience example after example of how systems seem to find endless ways to reinvent, replenish, and continue to inflict an unmeasurable amount of unnecessary suffering. And of all the ways we continue to harm each other, resist change, and fail one another. And also, this year has given us as a species so many opportunities for learning, for clearly discerning what ideologies, institutions, behaviors, and paradigms do not serve us, and for a chance to intentionally choose the seeds we need planting. We are staring at nothing less than an evolutionary leap. For millennia, we have been tugged between exploitative, one-sided ways to do survival and attempts at creating a world free of unnecessary suffering. We know there are many kinds of pain that are unavoidable to a certain extent, like rejection, heartbreak, illness, and death. But so much of the suffering we are experiencing is connected to the systems we built. Premature death and dis-ease, multi-generational trauma, power over and power grabbing built on the false premises of racism, sexism, ableism, homophobia, and nationalist fervor. Extreme inequities of resources, hunger, homelessness, isolation, and deep loneliness. We can do better than this. Because as humans, we have the capacity to choose which systems we continue to uphold, which we dismantle, and which we build anew. Look around, and you'll see all of the genius ways in which this is already happening. May the seeds of justice we plant flourish. We will seed better worlds. We will grow just futures. The link for that will be put in the chat. I really like that reading by Kiara Aku.
Yes, I put the link in the chat.
Thank you.
All right, Miigwech, thank you, Barb. All right, we have just a couple final things before we wrap up. A large part of our work is hearing community voice, and we want to present that opportunity to all of you right now. I want to direct your attention to the chat, and we want you to go ahead and follow that link there. And we ask you in 1 to 3 words, what is it that you are taking with you from this event? So if you follow that link in the chat, it'll bring you to a word cloud generator where you can enter a short phrase or words that resonate with the way you're feeling and or what you are committed to bringing forward after our time together today. So we welcome you to go ahead and do that. I love the words I'm already seeing pop up: hope, community, knowledge, inspiration, community engagement, power of connection. So much of that is exactly what our planning team was hoping that you would be taking away from our time together today. And so I just ask that you go ahead and post your words there, continue to watch this word cloud evolve. What I love about word clouds is that the more that something is mentioned, the bigger it gets. And right now I see hope really being that biggest piece of what people are bringing forward from this. So chi miigwech for that. I so appreciate everybody's leaning in, the work everybody is doing. It all matters. It all matters. And we're so grateful for each and every one of you as we continue to work together to create a more just and hopeful and thriving world for our young people and for all of us to enjoy and live in.
Yes, thank you. Continue to put them inside of the link that I provided, because it shows up on the screen and it looks the more responses we get, the more the image will grow. So losing my words, but
we encourage you to also just take a peek through the words being shared within the chat also. Such important things. We appreciate all of your voices and really do appreciate you sharing of yourself today.
And we will now turn it over to Jenna for our closing.
All right, thank you. Thank you for joining us at the gathering this year. Before we close, we will play our closing slideshow. This slideshow includes pictures of joy, community strength, and resilience that event attendees contributed to. The song is called Another Drunken Verse by Josh Woodward. We would really appreciate your feedback in the post-event survey. Once you fill out the survey, you can enter your name into a drawing for a $20 gift card, and there will be 25 winners. If you would like to submit a request for a social work CEU, you can find the link for the CEU request in the chat as well. And that will also be sent to you 2 weeks after the event, in the CEU will be sent to you after the event, once your attendance has been verified, which takes about 2 weeks. Finally, if you would like to review the recordings of any of the gathering sessions from today, they will be posted on the gathering event webpage in the next week. Thank you all for being here today, and we will send you out with the slideshow.
We don't hear music on this one. Did you? Oh.
These are all so beautiful. This is my favorite time when we get to see the slideshow.
Well, thank you so much for coming, and we hope you will come back next year for our 6th annual gathering. Have a wonderful rest of your day.
Thank you, everyone. So good to see you.